to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, we're super excited to have you here. You know why? Because we're bringing exciting conversations with leaders that are painstakingly shaping the future of healthcare. We also happen to be really passionate about leadership, access, healthcare innovation, and adoption. And if it's your first time tuning in, let me just sort of take a quick step back and just tell you a little bit about who we are and what we're trying to do here. So we are a healthcare innovation company. We're focused on bringing real stories of innovation to life, folks that are really in the trenches, making things happen day in and day out, and giving them the platform to be able to share their stories, not just the wins, but some of the learnings as well. And if you haven't checked out any of the historical episodes, go ahead and do that. But before you do that, make sure you hit the subscribe button now, ring the bell wherever you're looking at it, just so that you can get new episodes coming to you directly. So as part of our commitment to just sort of keeping you updated with the latest and greatest things that are out there, we've got just a phenomenal guest, an innovative leader who's really kind of pushing the boundaries and shaking things up a little bit. So I'm delighted to introduce a remarkable person who's really dedicated to implementing healthcare initiatives that drive population health. And Amy Prestifilippo, Vice President of Population Health at Advocare. Amy's got more than 3 decades of experience in education and healthcare. And she's a dynamic leader who really doesn't really fail to impress. She excels in everything, whether it's from organizational leadership to strategic planning and quality improvement. And she's established just a foundation for clinical operations, quality improvement projects, such as like hypertension, diabetes, and even obesity management. And when it comes to problem solving, get this, her strategic vision has resulted in improved clinic efficiencies that better serve patients and staff alike. And she's known for her futuristic approach and creativity, which really helps make healthcare services better for patients and staff. And she's going to be sharing some stories, her thoughts on really optimizing and using these innovative best practices, and her experience is just really robust. So, Amy, I'm really thrilled to have you with us today. Welcome to the show.
Thank you, Michael. That was quite an introduction. I appreciate it.
What goes through your mind when someone's like reading, sort of speaking about some of your body of work? I guess sort of curious what was going through your mind there.
Well, when you said 30 years, that was going through my mind. It has been a lot. I mean, I started as an elementary school teacher, which is interesting because as I've gone into the healthcare world, people will say, I can tell that about you because you approach everything kind of as let's approach this in a simple manner and then build from there. So I went from there into on-site patient care, healthcare, and then moved into a lot of the patient-centered medical home world, looking at each individual workflow in a practice and trying to make it better and trying to make it work for the clinicians and for the payers. So it was a great learning experience and kind of got me to where I am today.
So when you think about your experience as a school teacher and breaking things down, fundamentally making things more simple, in a sense, it seems as though that this is really the perfect role for you, because you're really taking complex concepts and trying to implement them. And sort of the angle that I wanted to sort of really pick your brain about today was you've done some pretty comprehensive deployments, some big scale projects. And I want to really kind of talk about maybe some of the pitfalls that you've seen and how you and your background have really been able to sort of navigate these complex circumstances. So maybe we can sort of talk about that for a little while.
Sure. So where do you want to start with?
So my thought is let's talk a little bit about where you are today, because that's obviously a pretty interesting environment. So maybe fast forward it to where you are today. Tell the audience a little bit about sort of, things that you're focused on now, and then we can kind of dig into, maybe some of the projects that you've been working on.
Okay, so just to give people a little bit of background about Advocare, we're based in Marlton, New Jersey, and we are across all of New Jersey and Pennsylvania. We have about 230 care centers, and with those care centers, we have adult primary care, pediatrics, and specialty. Our specialists are about 25% of our population, adult primary care 15, and then the balance is pediatrics. So we kind of live across a bunch of different worlds. We have close to 300,000 patients in 9 programs in value-based care. So those are the patients that, we're really focused on with a lot of our technology, and of course, focused on the care of our patients across all of our practices.
Tremendous. So let's talk. I mean, that's pretty big footprint. It's big scale. So when you're going into a project, talk me through, how do you approach a project? How do you make sure that things continue to stay online, stay on track, or if they do get off track, like walk us through your thinking in terms of where you can maybe foresee some pitfalls and how you sort of try to course correct before things even start.
Right. So when I came to Advocare, it was myself and one data analyst and our chief of payer relations and population health. So we had a care management department as well. So I had those tools to start with, and we had just started implementing Arcadia as our population health platform, and we work also at the ECW. So at that point, I realized we really needed to put more of a team in place. I mean, that we had a great start, but we really needed to build. So I did put a team in place. We built 4 different kind of arms of our department. So now we have our care management department, which consists of 9 care managers and care coordinators. We
Right.
have a value-based performance department, which has population health specialists in it, helping as well. And then we have data engineering, which really we needed to bring in to just pull everything together, because there's some things we can do with ECW and some things we can do with Arcadia, and then some things we just need to make up on our own. So Power BI reports are very helpful. And then we have our data analytics as well. We have someone who's very strong, and she is able to really make miracles. So it really is a team effort.
Okay, so foundationally, you said, all right, if we want to get to true north or ideal state, what does ideal state look like? And then where are you sort of today in terms of on that journey?
I think we're pretty much getting to a great state. I mean, it's very exciting. We've had an interesting year. We've worked through a lot of pitfalls, but with the team we have in place right now, we're able to kind of meet each challenge and move forward. One of the things that we really wanted to do was make sure our practices had up to date, up to the minute information at their fingertips. So we provide them with regular scorecards, and we were doing that for quality. And now we're able to provide scorecards for cost as well. So our practices are able to really think about those high utilizing patients and approach that from the standpoint of getting them the services they need and the help that they need.
Prior to it being real time, what was the methodology in terms of them getting reporting?
Right. So right now, whenever our reports come out, they do go onto a SharePoint site, and we find that the practices like getting an Excel spreadsheet that they can manipulate and work with. So we are doing that. However, we do have some new technology. We worked with Arcadia, and they had originally something called the desktop app, and it would pop up each time you opened a patient. It would tell you your gaps in care. We'll talk about some pitfalls with that. So, and what has happened since. So one of the pitfalls was the computers themselves had to be set up in a way that the pop-ups are on, and all these different kind of Microsoft things had to happen first. We had a whole team kind of trying to help people troubleshoot just getting the pop-up to work. So I think that was a common issue, and Arcadia jumped in and realized that it was really going to be best to embed it within the EMRs. So they do have a product now called Inform. So we have that product, which we just went through installing into ECW. It is a pop-up through Fire API.
Right.
We have some we're working with two technology vendors now, so in one way it works, and in other ways we need to get the pop-up screen to move, or
Yeah.
so that's kind of where we are right now. We have some practices that are piloting that and giving us feedback on the value of that product. So I think that it's just going to continue to improve, and I think as we give feedback to the vendors, it's really
Yeah.
great that they jump in and help.
So when you're piloting something, I mean, because you're such a, you have scale within your organization, how do you sort of decipher what size pilot to sort of launch? And what's the duration in terms of the pilots that you feel like you'll have enough substantial data and evidence to showcase that this can be used across enterprise wide?
Right. So we're really fortunate to have diet partners at our health. So we have a pediatric and an adult primary care physician who are our partners on the Pop Health team. And their practices are always the guinea pigs. They start with it and give us some feedback. And then we also have our population health committee.
How
So
often? How often do they give you feedback? Is this sort of like a weekly,
so
every other week? What's
ongoing.
what's that like?
Right. So we meet every Tuesday. And so we do get feedback from that standpoint, but we're also talking with them all the time. So that's really helpful. We do have the Pop Health Committee. They are a larger group, about 12 clinicians who advise us on, we'll show them things first and they'll say would be a disaster, or this looks fantastic. Let's try it. So we do have that support, which is really wonderful.
Well, give us a story when you showed them something and they said this would be disastrous, and why would it have been disastrous, and what prevented you from deploying it? So can you maybe any stories that come to
So
mind?
yes, so I think that yes, choose. So I think that anything that involves a lot of clicks, you hear that from physicians a lot. We have too many clicks, too many places to go, going into different screens. That's always extremely complicated. So I think that one of the problems that we've been kind of working around is our social determinants of health screening. We're using the prepare form, which is embedded in our EMR, which is
Hmm.
great. And now it's also being deployed to the patient at remote check-in. So they're able to complete that form. What we're finding is getting that information back to a place where the clinician is seeing it isn't always the easiest. And prior to the remote check-in, we had a workflow where the physician got a piece of paper and the medical assistant had to key it all in, and the physician had to address it, sign it,
Oof,
scan it in.
sounds
It
brutal.
was That was brutal. So that was not well received, but it was what we had at the moment. And it was
Yeah.
really important to our organization to do those screenings. So now that we have this a bit more automated way of doing things, you'd think that was the end of the story, but it's really not, because then the data was going into the EMR, but where? So we could find it if the patient kept their appointment. However, if they canceled, it just went away. It was in their chart, but no one saw it. So
Mm.
that's one of the data engineering and Power BI skills we pulled out. And our Michael, and went in and was able to make a dashboard for our care management team. So they're able to have visibility into every answer that comes in. So they are able to see, did the practice address it, or is it something they need to address? So that was a big win, but that was definitely something that had a rocky road to start.
So what are some of the myths that you've been able to sort of bust? And I preface that question because there's a big myth out there where that's trying to present a new piece of technology, and they'll say, you know what, our EMR does that. Um, was there any internal banter, when you came on, where clinicians were like, well, our EMR does that? And what did it take for you to sort of get through that hump? Or was that not the case for you?
So when I came to this role, they had already been with Arcadia for about a year. So they had
Okay.
already really made that decision that our EMR wasn't meeting those needs. We are constantly trying to marry the two and try to get things put in the right spot to make less work for the physicians. But until that time, we have job aids and a lot of kind of tricks of the trade templates that we create, and um, just areas where they can click to have a favorites list. So we kind of work through that every day.
Mm. So what's your main focus now, going into where we are now? What is your main priorities? What are some things that are really have you intently thinking on some of these priorities?
Right. So our main priority from a technology standpoint right now is to have really a seamless workflow for our annual wellness visits. In the past, we haven't had a large Medicare population. We just joined a Medicare Shared Savings ACO with risk. So we are, jumping on the bandwagon and making sure we have everything possible in the EMR. So at this point, we have our template almost complete. It's been tested and piloted by several clinicians. And we're also working on having some of those favorite lists available for them. So that's going to be a big help in getting the practices organized for that new adventure. And then we also are continuing with, our quest for social determinants and how we're going to address that in our care management department. We're also working with transitions of care and working on the best workflow that works for our clinicians across
Mm,
several platforms. We do all of our care management in Arcadia, so we transfer some information over for them to ECW as well.
makes sense. So when it comes to assessing additional technology, what do you look for with other partners? It sounds like you have a really great partnership with Arcadia. Um, when there's a gap in terms of what their capabilities are, I mean, how high of a threshold does it need to be in order for you to say, hey, we need to bring on more tech? Or do you revert to the classical, hey, let's put some people on this to try to create a workaround until we can flush this out further? What's your thinking around that? What's your process?
I think both. So I will talk to anyone that has a new technology. I love new technology, and there are a lot of people willing to partner with the larger vendors. They realize that no one will ever replace a larger pop health vendor that has connectors coming in from left and right and
Mm,
storing everyone's information. But there are a lot of add-on services out there that could be of value. It usually comes down to budget. So, you look at how much will it take to put a person on it, or have technology replace that person. But the problem with that is usually there's an additional app to log into. Oftentimes, it's not,
yeah,
oops, my lighting went off.
yeah,
Oftentimes,
it's still good.
oftentimes it's not something that is just going to integrate easily. So that's
Mm.
really been the holdup with accepting assistance from some of the vendors that we've talked to.
So the non-negotiable is like, hey, you need to play nice with our EMR, otherwise it's basically it's a non-starter.
Right, something that would either integrate, or they would use our data to do some of the work for us.
Mm.
That's another option, where if they could use our EMR and data in our pop health platform and put people on making phone calls or doing certain things, or feed it into their system to do automated work for us, that could help.
Okay. And where do you see like big scale implementations, deployments go wrong? I mean, you've done quite a few throughout your career. What are some of the main things that you've seen go off track, and what can you do to sort of prevent those from happening?
I think whenever you don't have input from the providers, I mean, that's the biggest one. When you think it looks great on paper, and this is going to be fantastic, they're going to love it, and then you show it to them and they say this will never work in a real practice where we're seeing, however many patients per day. So I think that's, when we get deflated the most is when we think it's going to be a great solution and it's not.
What's shocking to me is that someone would propose a solution without getting buy-in from, in my opinion, probably one of the most important stakeholders in the project is the person that's actually delivering the care. It's still shocking to hear that this occurs. Okay, well, what's the next one that you've seen that makes things go off track? Anything else that come to mind?
So I think not having the proper staffing in place, it's a lot more work than you think it will be, or you might need people with a different type of expertise. I think that with Arcadia, we found that we really needed someone with an engineering background to understand exactly what we were doing with the data on our end, since we have so much data, and just assisting us with that process and being intimately involved with it.
Okay, so making sure that you have the right resources, and let's just say you can't hire that person. Does that make a difference in terms of thinking through whether to deciphering to add the piece of tech or not?
I think that yes, it does really, because if you add that technology and put the expense in and it doesn't work, that kind of takes it off the table for the future as well when you might have the resources. So I'm more of a fan of, using the people we have and considering it for a future goal than to jump in and have it fail right off the bat.
Hmm. What is when you have deployed something and something has failed, let's just call it a failure. How quickly do you guys assess, pivot, walk us through the process of, whether it's like a postmortem, a learnings, um, looking back, what do you guys do in your organization today, or what have you seen that's best practices that you've deployed over your career?
Right. So I think, it's a constant assessment as things are going on, but then that kind of lessons learned after the fact. If something hasn't worked out and you had to pivot and move to a different direction, we try to avoid that, because when you're trying to steer a ship of over 700 clinicians in a direction, you don't want to tell them too many things too many times. They get a lot of emails and a lot of information. So we do try to get it right the first time around.
How do you, so, I mean, when you mentioned about, you being an elementary school teacher, do you purposely sit with your team and even kind of like pre-draft what communication is going to look like, distill it down even further? Because, better than me, also having myself been in the provider game for the better part of 15 plus years, people just don't read emails anymore. And it's like you have to send out communication. So aside from emails, how else are you communicating with a decentralized clinical workforce?
So that's a great question, and we're constantly evolving with that. So we have a monthly population health meeting, and our office managers attend that meeting. We do invite our clinicians, but very few, have the time to attend it. However, it is recorded, so they can watch it at any point they would like to. We have an intranet page, which is full of all of the information, all of our recorded trainings, all of our recorded meetings, job aids, anything they could possibly ever want related to population health. We also have a very large scale office manager meeting that our operations team runs each month. So they feature important tips from us on that meeting as well. We have board of managers meetings, which are about 8 or 9 times a year, where the lead clinicians from all of the practices are available, and we're able to present and give information. There's of course the emails, and we try to keep those brief and bulleted,
Right.
and the most information possible. And we also have been trying to have it sent out from our lead clinician rather than the population health team. So I think that it might get rid of, we're trying that right now.
And what do you think happens? Are it coming from a peer? You're thinking that there's a greater likelihood that they're going to read it because it's coming from one of their team. I mean, not
Yes,
that you're not a teammate, but just
right.
that.
It's not just something saying, SharePoint's been updated. It's actually information they need, and we use it sparingly. So it is important. He's not sending out every email. So trying to think, we try to hit things from every which direction that we possibly can.
How do you share little wins? How do you share little wins with the team? I mean, talk me through what it looks like when you're working in a decentralized team, but like, how do you emphasize culture, your mission? How do you kind of route it and bring it back to that? I mean, because that it seems like that might be a part that most miss, but be curious how you do it.
So our value-based performance team is available to meet with our practices, and they do meet with our practices bi-weekly, monthly, and they go over their scorecards with them and talk to them about, look how great you're doing with your colonoscopies or with your wellness visits. They'll kind of throw those things out. They also will send out a quick email and say, we see that your numbers have jumped this much, or that you've really been focusing on your wellness visits. And if we see that people aren't doing so well, we reach out and say, hey, can we help you a little bit? We'll call the patients and get some visits scheduled for you. Or, maybe we'll do a campaign through Arcadia that can encourage people to get their colonoscopy. So we're kind of constantly in communication with them and available for them as they need us.
I know we're kind of getting towards the end of our time, but I'd be remiss to say, I mean, I know that you love looking at new tech. I'd be curious to kind of get your input on what you think of a lot of this new buzz around AI and where you think the actual applications of it, like the real applications of it look like, this year.
That is interesting, and we've seen a lot of it, and there's
Yeah.
AI with the EMRs now. So I think it could be useful. I'm just not sure exactly where yet. Our patients don't have a communication source in that, like the text messaging with doctors or anything, but I've seen some pretty interesting utilizations of technology where a patient asks a question and it kind of goes through a set of prompts to guide them in the right direction. But I think that maybe using the technology to, help with gaps of care and making those calls, or, reaching out to patients and knowing exactly where they are and where they need to schedule. So I don't know.
Yeah.
We'll see. Well,
Yeah. And it sounds like right now, you're focused on the foundational things, right? The blocking and tackling and making sure you do those things right. And as you really master the trade, you can then start to add more tricks of the trade to even amplify things even further. Give us maybe just a quick commercial about how folks can follow you, follow your work, and even just follow some of the things that you guys are doing, as an
sure.
organization.
Sure, they can link up to us at Advocare LLC. So be careful you look for the LLC, and look for me on LinkedIn as well, Amy Prestifilippo. And I am, at Advocare day to day. So reach out, and I'd love to talk.
Amazing. Amy, thank you so much for even just sharing some of these insights. And for those that have listened into this conversation, if you found the conversation helpful for you, would you mind just engaging with our posts socially, liking and subscribing to it, and even just drop us a note on what you felt was most compelling. And Amy, if there's just one thing that we like to say, we're a community of doers and people that actually want to get stuff done. If there's one action item that you would assign to someone that's listening to this, what would that be?
I would say just be open to new things. Don't stick with the status quo, and just try to continue to grow and add on.
Amazing. Well, you heard it, Amy. Looking forward to having you come on again in the future, and appreciate everything that you're doing for the community and for the patients. So look forward to seeing you soon.
Thank you. It was a pleasure.